Hello, students, and we continue to study respiratory viruses. And this video is about actual respiratory viruses, paramyxoviruses, and coronaviruses. Okay, let's start with paramyxoviruses, causative agent of measles and mumps. The history of discovery. Measles virus was detected in 1911 by Anderson and Goldberg. In 1934, Johnson and E. Gottsbacher isolated the causative agent of epidemic parasites or mumps virus. Classification. They belong to the order mononegavirals, family Paramyxoviridae. And this family consists of few genera: Respirovirus, human parainfluenza virus, rubella virus, species mumps virus, morbilliviruses, species measles viruses, and henipaviruses, species hendra virus and nipah virus. And the most spread is human parainfluenza viruses, mumps, and measles viruses. Structure. All paramyxoviruses, they have the same structure. They have negative RNA, and they are enveloped, so it means that they have additional shell. Their RNA is negative and not segmented, and external lipid envelope of spherical shape. The size is rather large. It's bigger than the influenza viruses, about 300 nanometers. Nucleocapsid displays the helical symmetry. The matrix and protein support envelope structure. Glycoproteins are localized in the viral external spikes, and the large lipoproteins NH reveals both hemagglutinin and neuraminidase activity and promotes viral attachment to the susceptible cells. Glycoproteins or fusion protein provides membrane fusion and displays hemolytic and cytotoxic activity. So look in this picture, you can see NH proteins, which have both activity as a neuraminidase and hemagglutinin, and F protein, which interact in the process of fusion with the host membrane. Okay, this is an electronic photo of paramyxoviruses resistance. They can bind states with a low temperature exposure through some time heating. The action of organic solvents, disinfectant, and ultraviolet greatly inactivate them. Measles virus is the most unstable agent. It is inactivated within 30 minutes of room temperature. Viral replication cycle. The replication of paramyxoviruses occurs in the cytoplasm of infected cell. Attachment to the host cell is mediated via hemagglutinin protein. F protein activates the direct fusion. The envelope-free nucleocapsids are released into the cytoplasm after uncoating. Viral RNA polymerase catalyzes the formation of matrix RNA that encode viral proteins. In addition, a viral polymerase produces the positive strand RNA intermediate antigenome that serves as a template for synthesis of genomic negative RNA. So the process of protein synthesis is the process of replication. Nucleocapsid assembly is performed in the cytoplasm. Maturating virions migrate towards the cell membrane and interact with NH and F proteins. And finally, paramyxoviruses are released from the infected cell by budding. Look at this picture. So they interact with the host cell by its N and H proteins, then cause fusion of the cell membrane and enter to the host cell, uncoat them, and then start to reproduce itself by process of protein synthesis on the ribosome and the process of replication of uh, RNA, and then they released by the body. Okay, let's study each genera. First of all, respiroviruses, human parainfluenza virus. Parainfluenza, it's an infection which is very similar to influenza, but it's easier. And source of infection is people, sick people. Also, as in the case of influenza, iron-borne mechanism or rare direct contact. Incubation period is longer than incubation period of the influenza, about 7 days. Virus propagates the respiratory epithelium. Very often they induce mild upper respiratory tract infection, but in the infant types N1 and second part influenza virus provokes severe infection affecting larynx and trachea. Larynx swelling and respiratory obstruction cause the Krupp syndrome. Laryngotracheitis with obstruction and acute respiratory failure. Type 3 parainfluenza virus is the predominant agent of lower respiratory tract inflammation, resulting in the severe bronchiolitis and pneumonia. So, parainfluenza virus, it have three subtypes: one, second, and third. And one and second, first and second, they cause they affect larynx and trachea, and they can cause false growth. When we discussed diphtheria, we study what is croup. Croup is the process of obstruction of respiratory tract. When respiratory tract is closed, in the case of diphtheria, it closed by diphtherial biolinks. But in the case of respirovirus, it closed by the edema, because viral infection of larynx and trachea, it goes in children very quickly, edema formation, and edema tissue closes the respiratory tract. And type 3, it causes bronchiolitis and pneumonia. The immunity is predominantly mediated by growing secretory antibodies of immunoglobulin A class that blocks local viral propagation. Nevertheless, the infection rarely occurs. Diagnosis: specimen is obtained from nasopharyngeal washing, nasal and throat swabs. Rapid methods is ELISA and PCR. Also, immune fluorescence can be applied, but ELISA and PCR are most likely. Viral isolation can be occurred on the cell lines or monkey kidney cell culture. Virus type identification of performed by hemasorption and hemagglutination test. Serological diagnosis is made with paired cell tests, hemagglutination and hemasorption inhibition test, and ELISA are adapted for clinical use. Treatment and prophylaxis. Protein antiviral agent ribavirin is used for treatment of several clinical forms of parainfluenza infection, but we don't have any effective vaccine. Next, mumps. Okay, next infection, it's mumps or epidemic parotitis. And causative agent is rubella virus, mumps virus. Mumps epidemic parotitis is the specific, highly contagious acute virus disease which primarily affects parotid, sublingual, and submandibular salivary glands, with subsequent involvement of other glandular organs and tissue, pancreas, ovaries, and testes, kidney, and central nervous system. Only one serotype of virus is known. Look at this picture. You can see there. You can see the child which have infection of its parotid gland, of its salivary glands, and that's why it has such edematic face. Pathogenesis and clinical findings. Mumps virus infects humans, predominantly young children. It is anthropootic infection. Humans are the only source of infection. Disease transmission rate is in vaccinated children is near 50-70%. Mumps virus often gives epidemic outbreaks. The disease is contracted by airborne route. Incubation period is long, about 3 weeks. Primary viral replication is determined in nasal upper respiratory tract epithelial cell. Then the viruses spread the salivary glands and further to susceptible tissue and organs. The most typical symptoms of epidemic parotides are the enlargement and swelling of the parotid gland. Systemic viral dissemination affects different inner organs and central nervous system because of viral ability to propagate within epithelial cell. Specific pancreatitis and orchitis then may cause sterility are developed. Meningitis and meningoencephalitis are the main complication of on central nervous system in epidemic parotitis. Post-infection specific humoral immunity is lifelong and stable due to one antigenic type of virus. So we have only one antigenic type of virus, and that's why vaccination and infection is prevent reinfection. Newborn child is protected by maternal passive immunity within 6 months. Okay. Mumps pathogenesis. So virus enters through the respiratory tract by airborne mechanism, and virus grows in the salivary glands and local lymphoid tissue. So the first replication starts in the salivary glands, then it spreads very quickly to the by the bloodstream. Uh, so virus go to the bloodstream and disseminate to the organs and tissue, and its target is glands, pancreas, and they can cause pancreatitis, orchitis, and other destroying in the glands, and also it can cause meningoencephalitis, and it is the most severe complication. Laboratory diagnosis. Usually, mumps can be diagnosed only by the system because the manifestation is uh, very clearable. Laboratory examination is useful for diagnosis in apparent forms of mumps and for differential diagnosis. For express diagnosis, immune fluorescence assay with anti-mumps antibody is used. For virus isolation, the specimen are obtained from saliva, urine, and cerebrospinal fluid. Inoculation is performed into primary mump kidney cell culture. Mumps virus display characteristic cytopathic effect with cell round and Chian cell formation. In the cell culture, virus is detected by hemaabsorption or hemagglutination. Mumps virus identification is performed by hemaabsorption or hemagglutination. All viruses who have hemagglutinin, all these viruses can be identified by hemagglutination test. But we don't use cultivation very often. It's a very rare test because easier and quickly to find it by PCR. And also by ELISA, immunoglobulin can be determined in the patient serum. Okay, this is cytopathic effect, which can be observed in the infected cell. Treatment and prophylaxis. Treatment of the disease is slowly symptomatic. High effective attenuated live vaccine is used for worldwide for mumps-specific prophylactics. Mumps vaccine can be applied as a monovaccine, but in most cases it is administered like triple MMR vaccine in combination with attenuated measles and rubella viruses. It confers high-grade, long-lasting immunity. Next, infection is measles. Genera morbillivirus and species measles viruses. On this slide, you can see measles symptoms: runny nose, complex spots inside the mouth, sore throat and hacking cold, and high fever, inflamed red eyes, and rash, which appears behind the ears and spreads out over the head and face and then to the trunk and extremities. So, and high fever. Measles is another example of acute respiratory but systemic viral disease. It's caused by a specific virus of a single serotype that pertain to morbillivirus genus. Measles is extremely contagious. Its transmission rate in unvaccinated person is almost about 95 100 degrees, very high level of transmission. It's a slowly human anthropogenic illness. Measles virus usually gives outbreaks of the disease among children. We usually said that measles is a children's disease, but in the case of adults, measles is more hard, is severe, and more serious. Pathogenesis in measles. Many people think that kids infection is not serious, and they think that it's like a flu and cold, and vaccination and prevention is not important. But before vaccination, a lot of people, children, are died from the measles, and nowadays we have lethal outcomes after measles because it's a very serious disease which can cause systemic disease, which can affect not only respiratory tract but the neural system also. Uh, the transmission is also airborne. Incubation period is about 2 weeks. Uh, Virus replicates in respiratory tract firstly, and then move to the regional lymphatic nodes. That's why one of the first symptoms is the big lymphatic nodes. After second propagation in the lymphoid tissue, it spreads through the body and through the blood, and they goes to the bloodstream and spread through the body and penetrates into epithelial cell in skin, and that's why we have rash, conjunctiva, that's why we have red eyes, endothelium of the vessels, respiratory tract, etc. Virus persist within circulation immune cells that facilitate viremia. GN cell appearance and symplast formation is observed in tissue epithelial cell. Measles virus F protein activates intracellular fusion. It permits direct viral spread across the epithelial layer and prevents viral against antibody neutralization. Prodromal phase lasts several days and it is shown that to be highly contagious, so without specific symptoms, these patients um, highly contagious. Viruses is extracted with biological fluids, urine, nasal secretion, and appears in the blood. Kaleidoscopic spots are developed in the buccal epithelium in oral cavity of patients, and this is a specific symptom, kaleidoscopic spot. The spots are the sites of intensive viral replication. This finding is proven to be pathognomonic symptoms of measles. Pathognomonic means that only in the case of measles such spots can appear. That kaleidoscopic spots shows that it is measles. Fever and maculopapular rash are the other main clinical finding of the disease. Eruptive phase lasts about 5 days. Rash development results from T cell cytotoxic activity directed against the virus-affected capillary endothelial cells. Rash descends from the face to the body and legs and dampens gradually within 1 2 weeks. The main complications in measles are secondary bacterial pneumonia, otitis, and disorders of CNS encephalitis. The extremely rare but potentially lethal late post-measles complication is subacute sclerosis panencephalitis. Please remember that it's a rare but very similar serious complication. After many years, this patient can reveal subacute sclerosis panencephalitis, and no one treatment can have a success in this case. Its many appear in many years after infection regress because of immune system incapability to eliminate measles agent. The virus persists within CNAs, causing gradual damage of neural structures with fatal consequences. Okay, pathogenesis. Look at this picture. So, viral by airborne transmission enters to the respiratory tract and replicate in the cell of the respiratory tract, and then it goes to the lymphatic nodes, and after lymphatic system it goes to the bloodstream and cause viremia and disseminate to the whole body, all human tissues and organs, and multiplicate in conjunctiva, respiratory tract, urinary tract, small blood vessels, lymphatic system, and CNS. And it infects endothelial cells. That's why rash occur. And also, rash is because of destroying endothelial cell by viral action and also by T cell. After recovering, person get lifelong immunity, and also as a complication it can be post-infection encephalitis and subacute sclerosis panencephalitis. Okay. Okay, here you can see complication encephalitis, ear infection, pneumonia, diarrhea, and humoral immunity against measles develops in 10-40 days after the disease onset. It is maintained by circulation antibodies. Immunity is lifelong and stable. Maternal anti-measles antibody passively protect newborn for 6 months. And also, I need to say that new study, new research show very interesting process that measles virus, it can arise immune memory. So it can destroy all cell memory uh, and and immunity which was kept all human life, immunity after meeting with different pathogens, it can be erased by measles virus because it can affect memory cell also. Diagnosis. Okay, in this case of measles, we usually can um, do PCR, ELISA, and cultivation. But cultivation is not often applied, but PCR is the best way to find viruses, these viruses. Specific prophylaxis, as it was the case of parotitis, mumps, uh, there is very good live attenuated vaccine, and it is a part of MMR, measles, mumps, rubella vaccine. Treatment of measles is supportive if requires infusion therapy and body disintoxication is administered. And also antibodies against measles can be applied for treatment. Rubella. Causative agent is rubella virus. Okay, history of discovery, classification. It is not part of paramyxoviruses, but it's a Togaviridae and genus Rubivirus. It is envelope virus. Envelope is composed of host-derived lipid bilayer with embedded spikes made up of E1 and E2 glycoproteins. RNA is positive, non-segmented. Okay, and also only one serotype of viruses exist. When we talk that virus can have a few or many serotypes, that means that immunity will be serotype specific, and that means that after infection you will have immunity only one serotype, but you will not have immunity against another serotype. And when we talk that causative agent have only one serotype, that means after infection immunity will be lifelong. Okay, RNA positive enveloped viruses with the spike proteins E1 and E2. It can stay infectious outside only for for about 1 day. Gradually lose infectivity under freezing, heating, inactivated by organic solvents, ultraviolet, disinfectants, and sensitive for pH fluctuation. And so it is not very resistant. Okay, replication cycle. It enters to the cell by endosomal outtake, and E1 and E2 glycoproteins under endosome acidification stimulate the fusion of the viral envelope to the endosomal membrane. Then process of uncoating. Then because it's a positive RNA, it does not need transcription. So the process of translation began quickly. And also um, viral RNA occurs in the nucleus, and replication complex. Mhm. Okay. Okay, and releasing is performed by the body. Is it usual for all enveloped viruses? Pathogenesis rubella affects unvaccinated individuals. The infection is transmitted via airborne route. Transmission rate for non-vaccinated exceeds 18 19%. Vertical mother-to-children transmission result in congenital rubella syndrome. Rubella is anthropootic disease. The source of infection is slowly human. Rubella is not so serious for a person as measles, and infection is not so hard, but it has strong complication in the case of mother to child transmission. Okay, the upper respiratory tract and nasopharyngeal lymphoid tissue are the first site of viral replication. Next, virus migrate to the regional lymphoid nodules. Incubation period of the disease lasts about 3 weeks. The clinical manifestation of rubella virus infection in adults are generally mild, and many infections are asymptomatic. The first clinical sign of rubella is usually the appearance of the macropapular rash. Other symptoms typically include low-grade fever, lymphadenopathy, sore throat. Lymphadenopathy is typical, involving the posterior cervical and occipital nodes. Rubella can cause complications with joint envelopment, such as transitory arthritis. But the most important influence of rubella is teratogenicity. Maternal infection early in pregnancy result in congenital rubella syndrome, CRS, in infants. The time the infection affects women during gestation can influence CRS outcome. The earlier in gestation the maternal infection occurs, the more severe is the damage to the fetus. Maternal infection during the first 8 weeks inevitably results in fetus death. In the condition up to the 100% of infected fetus develop congenital defects. So the defects which caused by these viruses is depend on the stage of pregnancy. Earlier um, um, gestation, uh, infected in the earlier stage of gestation cause the fetus death. And after 70 weeks of gestation, the risk of developing any defects is low, and it is very important. The risk of fetal infection and the severity of congenital abnormality decreases after the first trimesters. The clinical manifestation of CRS vary significantly. The deafness is most common. The other clinical features include cardiac disease, mental retardation, and ocular impairment such as cataracts and glaucoma. Please remember this triad: cardiac disease, mental retardation, and ocular impairments. After disease, lifelong humoral immunoglobulin mediated immunity arises. Maternal antibody protects the newborns against rubella within 4-6 months after birth. For diagnosis, we can use PCR and serological diagnosis. Also, um, cultivation is possible but not applied nowadays. Treatment and prophylaxis. Usually we don't use specific treatment because rubella is not serious disease. But we have live rubella vaccine, which is a part of MMR vaccine. And this is a prophylaxis of rubella and CRS syndrome of um, the fetal disorders. Okay. And the last one is coronavirus. Okay. Uh, First human coronavirus was isolated by Tyrrell and beyond from the patient which acute rhinitis in 1965. It was generally assumed earlier that coronavirus caused only mild, short-lasting respiratory or enteric disease with completed patient's recovery. Before, before the 20 because before 2000 years we talk about we talked about coronaviruses as a positive agent of respiratory tract, but not serious mild infection, and actually we don't study it too much. But first sign of this infection as a serious infection was in 2002 when severe acute respiratory syndrome as SARS were revealed, and also it was revealed in 2003, and in 2012 another types of viruses, Middle East respiratory syndrome, also show its seriously. And now we talk about coronavirus as a causative agent of COVID-19, and as, as a very strong and hard infection which take a lot of humans' life and cause new pandemic. And now coronavirus is a part of our population because it is like influenza virus can mutate, and it will presence in our population, I think, always now. Okay, look at this picture how history of COVID, how it start and what we have today. Okay, classification, it's belongs to the order Nidovirales, family coronavirus, subfamilies Coronavirinae and Torovirinae. Coronavirinae subfamily contains 4 genera, each of several species. To date, 6 species of coronaviruses are registered, which are definitely pathogenic for human. SARS, MERS, and COVID-19 coronavirus species pertain to genus Beta coronavirus. According to serological and genetic properties, 3 groups of coronaviruses are known. Groups 1 and 2 harbor mammal pathogens. Group 3 includes avian viruses. Human pathogens are present in both first and second group. SARS and MERS coronaviruses pertain to the group second. Okay, structure. It's an enveloped viruses, single-strand positive RNA. Nucleocapsid is of helical symmetry. Glycoprotein spikes around viral envelope, resembling some growth. And SARS virus has 4 major structural proteins: inner nucleocapsid and proteins, membrane M proteins, envelope E proteins, and the main is C spike proteins, which innate the infection of the cell, and which is a strong antigen, and they cause the antibody formation. Okay, S spike, it this protein interact with the cell receptor and initiate the infection of the cell. Inner N antigen nucleocapsid envelope protein, and membrane protein. Resistance. Coronavirus are rather sensitive to external influence, as detergents and other disinfectants, as well as heating about 65 degree, 66, 36 degrees readily inactivate them. SARS-CoV is relatively stable in comparison with other coronaviruses. It maintains viability in feces and urine for 4 days at room temperature. It is easily withstand cooling. Heating kills it very quickly. As other coronaviruses, it is sensitive for all conventional disinfectants. Replication. SARS virus enters epithelial cell or upper respiratory tract via binding of spike S protein to specific cell membrane receptor angiotensin converting enzyme ACA2 receptor. As glycoprotein mediates absorption and subsequent fusion of viral particles with susceptible cell. So it is a very important moment in the COVID infection when spike protein of the coronavirus interact with ACE receptors, and it initiates the process of membrane fusion entering. Look at this picture. You can see interaction between spike protein and ACE receptors. Encoding is followed by the translation of viral proteins from viral RNA. Initial single protein chain is produced that is eventually cut into mature proteins by viral protease. New formed viral replicase enzyme activates genomic RNA replication. Viral genome is transcribed through intermediate minus RNA strand that serves as the template of final positive sense RNA synthesis. So RNA negative matrix formate and then RNA positive, and this matrix began to replicate. Virus multiply in the cytoplasm of infected cell. After viral assemblage, the viral particles are released out of the cell by body that is promoted by M, E, and A and proteins. The death of infected epithelial cell is caused by direct viral cytopathic effect as well as by immune cell lysis. So attachment with S protein, then uncoating, then genomic RNA positive became free, and the process of translation and formation of RNA negative part, and also the process of protein synthesis on the ribosome, and the process of the replication of RNA in the cytoplasm, and then assembling and releasing by body. Okay, also you can see how it go on. Pathogenesis, the source of infection in verified SARS case were sick humans. The disease is contracted predominantly via airborne route. Human-to-human transmission is common. Target host receptors are found mainly in the human respiratory tract epithelium, including the oropharynx and upper airway. The conjunctiva and gastrointestinal tract are also susceptible to infection and may serve as transmission portals, but not often. Often is airborne transmission. Transmission risk depends on factors such as contact pattern, environment, infections of the host, and socioeconomic factors, and as described elsewhere. Most transmission occurs through close range contact, such as 50 minutes face to face and within 2 meters. And spread is especially efficient within household and through gathering of family and friends. Okay. This is how it was transmitted from the bat to the person. Previously, the source of infection was animals, bat and civetta. And then virus mutate and start to be able to interact with the human's cell. The target cell is the cell which have ACE second receptor. Active replication and release of virus in the lung cell lead to non-specific symptoms such as fever, myalgia, headache, and respiratory symptoms. The distribution of ACE2 receptor in different tissue may explain the sites of infection in patient symptoms. For example, the ACE2 receptors is found on the epithelium of other organs such as intestine and endothelial cells and kidney and blood vessel, which may explain gastrointestinal symptoms and cardiovascular complications. Lymphocytic endotheliitis has been observed in post-mortem pathology examination of the lung, heart, kidney, and liver, as well as liver cell necrosis and myocardial infarction of patients who died of COVID-19. This finding indicates that the virus directly affects many organs as well as was seen in SARS-CoV-1 and influenza. Okay, this is uh, how it go on, the pathogenesis. So it is entered by respiratory tracts and spread to the cell with ACE2 receptors, lungs. In lungs, it causes kill, cell damaging, inflammation, and cytokine releasing. And from the bloodstreams, it goes to the heart, causes viral myocarditis, and damaging of kidneys, digestive tract, and cause multiple organ failure. On this slide, you can see which cell has the ACE2 receptors. Okay, nasal, lung, ileum, heart, eye, liver, bladder, kidney, pancreas, brain, prostate, testis, and placenta. So it have ability to damage all the cell of the human body. And look at this picture, it can damage nasal cell, and this is because we in the start of infection, the losing of this people have such symptom as the losing of the smell. Look at this picture. So this is B olfactory epithelium high magnification with a specific olfactory cell, and this specific olfactory cell has specific cilia, olfactory cilia, which catch the odor molecules. That's why we can feel the smell, because specific olfactory cell, it catch the odor molecules and transmit information to the neuron, and we feel some smell. And coronavirus, it destroys the cell, and people lose ability to feel the smell. Laboratory diagnosis, prophylaxis, and treatment of coronavirus infection. Cell culturing is rarely applied due to poor viral propagation in the cell lines. For express analysis of nasal swab or nasopharyngeal washing, immunofluorescence assay for viral antigen, and PCR for identification, and also EHA as a serological test can be apply as a express method, and ELISA to find antigen and antibody can be applied. Okay, vaccine. So we have in Europe we have three types of vaccine: Moderna, Pfizer, and Sinovac. In Russia we have Sputnik. And Moderna, how it works is the messenger RNA vaccine teach human cells to make spike protein found on the virus that cause COVID-19. Our bodies learn to recognize that the protein does not belong there and make antibodies against future infection. And Sinovac is the inactivated virus vaccine used in weakened from a live virus, stimulating our bodies to produce an immune response. Okay, Moderna and Pfizer show high efficiency, but Sinovac not have information. Okay. And then I will talk to you about how Russian vaccine Sputnik was created. So it's a vector vaccine in which vector delivering system was applied. So what uh, do they do? Okay. I want to. Okay. Um, Researchers uh, they study um, the genome of the coronavirus and find specific gene which encode the spike protein formation. But genome of coronaviruses is not DNA but RNA. That's why they take this part from RNA and modulate DNA, modulate the DNA, which is complementary, similar to the DNA part of coronaviruses, which encodes spike protein synthesis. And then they put this fragment of DNA to the vector viral vector which can enter to the human cell but can't replicate in it. And this vector was adenovirus. And after getting genome information how to produce spike protein, it became to produce spike protein, and on their surface, proteins appear. So vector is just look like coronavirus because it has corona, because it has spike proteins. And when it interacts with human cell, it on the surface of infected cell with vector, a lot of spike proteins presence on the surface of this cell. And immune system start to recognize and start to produce adaptive immunity. That's all. Thank you for attention. If you have any question, please ask.